Arthritis is not just a people ailment, it also affects our canine friends of all ages. In fact, experts say that 1 of 5 dogs in the United States is apt to suffer from arthritis. The disease, which results from the inflammation of joints, is one of the most common sources of chronic pain that veterinarians are called on to treat. Canine arthritis is generally divided into 2 types: degenerative and inflammatory. It is the source of irritation is what determines the type. Degenerative joint disease, which is also known as osteoarthritis, is a result of the destruction of cartilage that protects the bones that make up a joint. This can result from normal stress on abnormal joints or abnormal stress on normal joints. For example, hip dysplasia, which is a malformation of the hip sockets, is a case of normal stress of abnormal joints. Examples of abnormal stress on normal joints includes the stretching or tearing of ligaments during exercise injuries, falls, and accidents. Degenerative joint disease can be either a primary disease for which no known cause is visible, or a secondary issue in which the cause is evident. Secondary degenerative joint disease can sometimes be prevented or stopped with a surgical procedure to repair joint problems. It can take years for degenerative arthritis to show up in dogs. This is partially due to the fact that cartilage does not have nerves, so the damage can progress until the joint's lubricating fluid has thinned enough to lose its ability to protect the surfaces of the bones. Infection or underlying immune-mediated diseases cause inflammatory joint disease. This type of arthritis usually affects more than one joint, and it is frequently accompanied by symptoms such as fever, anorexia, and a general overall stiffness. Infectious joint disease can be caused by tick-borne diseases, bacteria, and fungus. Immune-mediated arthritis can be hereditary and is caused by a weakness of the immune system. It is important that you take your dog to visit the veterinarian if you suspect arthritis. Infectious joint disease and immune-mediated joint disease are treated differently. An accurate diagnosis is vital to choosing the right medications. Some common symptoms of arthritis are stiff and sore joints, weight gain, decreased activity, behavioral changes, excess sleeping, and difficulty sitting or standing. A dog may seem to favor one of its limbs. If any of these symptoms last for a week or more, schedule an appointment with your dog's vet. Early diagnosis is best. It is important to provide a healthy diet and plenty of exercise for your dog to avoid a weight problem, which opens the door to arthritic conditions. You might also try over-the-counter food supplements such as glucosamine and chondroitin. Veterinarians commonly prescribe anti-inflammatory drugs that does not contain steroids. It may take a combination of food supplements and drugs to successfully treat your dog's arthritis. Thus, it is important that you and your dog's veterinarian communicate and work together in the fight against arthritis. Fido will certainly be grateful. If you need more information or coaching in any area of dog and puppy care, from training to advanced tricks to how to care for your